Welcome back to Great Day. It can sneak up on you, and before you know it, and something as simple as walking can become tiring and painful. Add bulging veins, a dark rash that won't go away, and wounds that won't heal. That's a pretty good indicator that you could have vein disease. Our next guest can quickly diagnose you and treat the problem. Dr. Rajiv Agarwal with Modern Heart and Vascular Institute has a painless treatment with little to no downtime. But first, let's find out why veins in our legs seem to go against the flow sometimes. Good morning, Dr. Agarwal.
Good morning, Deborah, and go Astros.
Yes, go Astros, but don't go vein disease. What is happening in our legs when we have all those symptoms I just talked about?
Right. So we have two sets of blood vessels in our legs. We have arteries and veins. So vein disease is problems with blood flow coming back. So arteries take the blood down, veins bring it back. So if blood is not returning back to the heart, to the lungs to get oxygenated, people get a lot of symptoms. Symptoms can be quite significant in these patients, Deborah.
Yeah, as we mentioned, I mean, it can really shut somebody down. But sometimes, again, as I mentioned as well, people misunderstand what's going on. We think it's a dermatology thing or a muscular thing, and it's not.
Yeah, as you see on the picture on the screen, veins have valves in them, and the valves, they open and they close. If the valves are not functioning properly, blood is going to go backwards instead of forwards, back towards the chest area. And those lead to the symptoms, and the common symptoms being swelling, bad cramps, Charlie horses, restless legs, just achiness, fatigue, tiredness in the legs that people have dealt with for months and years. And unfortunately, they just haven't looked to get treatments, and those symptoms can be made to go away pretty rapidly, Deborah.
Yeah, and some of the symptoms between poor artery circulation and vein circulation kind of overlap. That's the importance of coming in to someone like you and getting a proper diagnosis. What is that diagnosis like?
Yeah, so the step number one is we talk with them. We see if their symptoms are more with exertion, which would suggest more artery disease, or symptoms more at rest at night, then that would suggest more vein disease. And we talk to them, we listen to them, we examine their legs, and then if necessary, we get an ultrasound of their legs to see exactly what the problem is and how bad it is and where it is in the legs. And then we discuss all the treatment options. So pretty non-invasive, simple stuff to get the diagnosis.
And when it comes to the risk factors, that's something else that gives you some clues as to what's happening. Give us the risk factors between arterial disease and venous disease.
Arterial disease is just like having blockages in any other parts of the body, including your heart. So we see a lot of people that have blockages in their widowmaker artery or other arteries of the heart. Those risk factors are the traditional smoking, diabetes, high blood pressure, high cholesterol. And we all should also include COVID in that now. So I always encourage my patients that if they've had COVID to get themselves checked out. For vein disease, again, it's more symptoms at rest. So what are we doing that we're not moving? Obesity, lack of motion, hormonal issues. Women just tend to get more vein disease than men do because estrogen plays a role into it as well.
Okay, and that's not fair. But anyway, you mentioned earlier about some of the treatments, and they can be done fairly quickly. And I want to make sure that people understand if they saw their parents or grandparents go through some vein treatments in the past that were pretty aggressive, that's not what we're doing today. So take us through what you can do to help with vein disease.
Yeah, the years ago when people would say, "Oh, I had my leg filleted open," and then they took out the veins, those days are gone. Nowadays, things are done in the office. Takes about 5 to 10 minutes. You drive yourself to the office, we fix it, you drive yourself right back home. So what's done is we numb up the area in the leg that where the bad vein is. We put an IV catheter in there, and either you're injecting heat or glue or foam to seal off that vein. So now we're redirecting the blood flow to the good veins, and then the symptoms that were being caused by the bad veins, blood's no longer going into that vein, so the symptoms are pretty much gone.
Yeah.
And you see on the screen there how easy the procedure is. It's pretty much painless, but if there is a little bit of discomfort, we numb it up.
Yeah, and people are up and walking like immediately after.
Oh, yeah, they drive themselves home, Deborah. So there's little to no recovery time at all. We have them walk in the office for a few minutes, and then they're free to go and enjoy their lovely legs
Yeah,
going forward.
yeah. As we saw there, the before and after, the legs went to lovely. Restless leg syndrome is something that we've heard a lot about recently. In fact, there's a medication for it, and you're one of those doctors who your thought is, if we can get rid of the problem, let's not treat the symptom. Let's just actually get rid of the problem. You treat that as well.
Right. With any cardiovascular issue, we like to get to the root cause of the problem. I don't want to provide a band-aid or a temporary fix for the patient. We want a cure. A lot of people are misdiagnosed with restless leg syndrome, which is an actual medical diagnosis. But why do they have the restless leg syndromes? Why do they have the swelling and cramps? We get to the root cause of the problem, so the symptoms can be cured forever.
Yeah. Let me just also end with the fact that you all deal with all things heart, which include the veins issues that we talked about and artery issues that we talked about, but you also work with kids as well.
Yes, Dr. Joshua Quinones, our pediatric cardiologist, has joined us, and he's doing remarkable things in kids, especially nowadays with all this news about heart events in kids, including LeBron James's son. The goal is to screen people and prevent all of these bad things from happening to our little ones.
All right, Dr. Agarwal, thank you so much.
Thank you, Deborah.
And to book an appointment with a board-certified cardiologist at Modern Heart and Vascular Institute, visit them online at modernheartandvascular.com, modernheartandvascular.com, or give them a call at this number, 832-644-8930. Again, that's 832-644-8930. They accept most major insurance, including Medicare. Appointments fill up fast, so contact them today. Modern Heart has locations throughout the greater Houston area, including their newest location in Tomball. By the way, they have doctors who are also fluent in Spanish.